So if you're the type of biohacker that focuses on minutiae and thinks that peak health advice involves bathing your gooch in infrared light in between sets of freezing your arse off in cold plunges, this is not the vid for you. We're going old school, meat and potatoes, back to basics, the medical equivalent of the gym bro holy trinity, the squat, the deadlift and the press, aka blood pressure, blood sugar and lipid management. My name is Dr. Paul O'Brien. I'm a registered medical doctor currently practicing in acute care in Ireland with a background in genetics and food science. Today, I want to talk about high blood pressure, aka the vascular vandal, the most dangerous risk factor you might not even know you have. So high blood pressure is called the silent killer for a reason. It's the leading modifiable risk factor for heart attacks, strokes, kidney failure and vascular dementia. Globally, over 1.3 billion people have it. Half of these people don't even know. Now here's the good news, in many cases it's fixable without medication. Lifestyle changes can work just as well as medications, if not better, but only when they're clear and prescriptive. So no vague advice today, we're going specific, evidence-based and actionable. First of all, what exactly is high blood pressure? It's readings consistently 140 over 90 or over in terms of millimeters of mercury. Anywhere between 120 to 139 is pre-hypertension and that's your warning light. So let's talk about what actually works and what you can try yourself to lower your blood pressure naturally. Top tier amongst lifestyle changes and supported by the strongest evidence is weight loss. Every kilogram of excess weight you lose roughly correlates to a drop in systolic blood pressure of about 1 millimeter of mercury, and that's strongly supported by multiple studies, most notably the TOP trial. Second is adopting the DASH diet, an acronym which stands for Dietary Approaches to Stop Hypertension and involves a diet rich in potassium, low in sodium, particularly from ultra-processed foods, and full of fiber, which was shown to reduce blood pressure in the landmark DASH trial published in the New England Journal of Medicine. And then number 3 is exercise, including both aerobic and resistance training. If you don't have time for that, even something as simple as isometric hand grip exercises have been shown to reduce resting BP in smaller scale clinical trials. 4, managing stress and reducing your alcohol. Both raise your blood pressure silently and both are fixable. Finally, supplements and dietary aids. Substances like L-citrulline, taurine and magnesium have been shown to reduce blood pressure by a few points and can be a meaningful adjunct when more important things are dialed in. So we're going to focus on the important things first. We can look at supplementation later. Finally, hypertension is silent until it's not, so track it, treat it, and don't wait for the stroke. So going forward, please follow me for real, no fluff, science-based health advice from someone who works in acute care, not just on TikTok.